First of all, let's kick off with rehab because this is serious. You know, if you get hurt, you need help. And I've got the person to help you, Karen Russell.
Hello, good morning.
Nice to have you on again.
Thank
Mountain
you.
Valley Regional Rehabilitation Hospital, Prescott Valley.
Yes, indeed.
I tell you, that is the greatest place. I went over there and did the anti-gravity thing. I had so much fun. That was almost better than skydiving, you know?
It is. It's a fantastic place. It really is. And really fills a void in our community that we didn't have 10 years ago.
Yeah, and you do so many different kinds of things.
We do.
So what types of physical rehab services are there, and what are the differences in those?
Yeah, there really are a lot of choices, and I think it's important for individuals to know the different levels of rehab. So if they have a medical crisis, they are making a well-educated decision on what is best for them.
Right.
So you have your highest level of rehab, which is acute rehab. So that's a facility like ours. You get the most therapy and the greatest amount of physician care when you go to an acute rehab facility. Then you have subacute, which is generally handled in a skilled nursing facility. Then you have home health. So individuals that are not able to get out of the home can still get rehab services. And then the lowest level is outpatient, which is crucial, but yet it might just be the next step in your rehab process.
At the end of the rehab,
right,
sort of.
Exactly.
When you're well enough to be able to do
drive
your own
and get
things.
out in the community.
Now does Mountain Valley Regional Rehabilitation Hospital, do you handle all those levels? Or
Actually,
just the acute?
Actually, no, that's a good question. We actually handle all of them except for the subacute. So we are an acute rehab facility, so we handle that. We added home health services about a year ago, so we can really reinforce the continuum of care. And then we also have outpatient services.
Okay, so we want to choose the best of all those. What about insurance? Because that's a big thing going on right now. How does that affect our ability to choose?
It really can dictate a lot of what you can and can't do if you need to have some type of an inpatient rehab stay. If you're on a commercial insurance, all those plans are going to be different, so it's important to check that out to see what you have in your benefits, because it is, if you have a major medical crisis, especially if you're younger, maybe a car accident, you want to know what your choices are. When it comes to Medicare, it's important for individuals to understand that they're all different benefits. So you could potentially have an acute rehab stay, maybe you're still not strong enough to go home, then you can go to a skilled nursing facility, then you finally go home and you get home health and you can get outpatient. Because those are all different benefits, you can actually go through all of that level of therapy and not exhaust your benefits, because each one is considered a different part of your Medicare
Different
benefits.
classification.
Yeah.
Wow, interesting.
Yeah.
So then how do you choose where to go for, let's say that you need acute, or you need, you know, how do you make a choice? Because there are
Right.
some duplications.
There is. A lot of it is going to depend on what you can tolerate. When you're at an acute rehab facility, you need to be able to tolerate 3 hours of therapy a day. It's spaced out throughout, you know, an 8 or 9 hour period, so it's not like a 3-hour boot camp session where you have to go in and we're going to just
And you're not in
work
great
you for
shape
3 hours.
anyway.
Right, because you're in you've just had some type of major medical event.
Right.
So it's important that you can tolerate the 3 hours of therapy a day. That level of therapy, we're also looking for individuals that have a major medical need. They need a physician management every day to manage maybe vitals, blood pressures, anticoagulation meds, arrhythmia meds, something where a medical doctor needs to really supervise your care every day. The most important thing to remember is the sooner you can go home, the better it is for you. So for some individuals,
We like that.
yeah,
That's
they may
of
be able to
course.
go right home with home health. So you are going to really make the best amount of progress and have the best outcome the sooner you can get home and get back into your normal routine.
Wow, interesting. Well, it is National Rehab Week next week, incidentally, or well, the
In a couple
18th through the
weeks.
22nd,
Yes.
right? In a
Yes.
couple weeks. So, anything special going on at Mountain Valley Regional Rehabilitation Hospital for that
Yes,
event?
we are actually really excited. We do a lot of fun things for both our patients and the community that week. And the Thursday, September 21st, we are bringing in Dr. Bradley Williams. He is a newer orthopedic specialist here in our area, and he's going to be talking about joint treatments. So it can be any type of a joint, whether it be the hip, the knee, the shoulder, ankle, and he's going to really talk about the latest and greatest in terms of what you can do if you have arthritis in the joint. It's always best to go for a more conservative treatment versus going right into a joint replacement surgery. So he's going to talk about all the different injections. There's so many out there. what is the best for you, what are they seeing the best results with. He's going to talk about the stem cells, the different lubricant injections. He of course will talk about joint replacements. I think his specialty is more in the joint, the shoulder joint. And years ago, we really didn't see a lot of shoulder replacements because the outcome was so poor. But his really do very, very well. So we're starting to see more total shoulders through his surgeries because patients are really having a good outcome because his techniques are a little different.
Oh, fascinating. Yeah, I know if your rotor cuff goes or if your knee goes or
Right.
any joint, you know, you're in real trouble. And the back is always something too. You know, it just seems like those are our pressure points. We've got to have those things working, our little connectors, or else nothing works well. What kinds of things do people need rehab for besides the joints, for instance?
You can have any type of major medical crisis. So whether it be you've had a heart attack and you've had to have open heart surgery, maybe you've fallen and broken a hip, you know, a stroke, of course, head injury, maybe a trauma. So if you've been in a car accident or any type of an accident and you have multiple fractures, maybe a spinal cord injury, or maybe even a case where you've been in the hospital with pneumonia and you've got what's called septic where it gets into your blood and you just get really, really ill and debilitated, you cannot go home because there's no way you can function independently. So you may need to go get some type of inpatient rehab before you go home so you can get strong enough to go home and be able to function safely. The thing we're really trying to streamline, especially with the local hospital, is not getting readmitted. So we want you strong enough so that you're not going to relapse.
Oh, very good.
Yeah.
Absolutely. And why rehab's kind of an important thing to do. Can people get along without it on some, you know?
Sometimes yes, especially some of the newer joint replacements, the new approaches with the hip surgery. Nowadays, you can go straight home with home health because there's so much less trauma in the surgery process.
I'd say it's come a long way, but we're really thankful to have this wonderful rehabilitation facility in Prescott Valley because it serves the whole Quad Cities area. Very, very important.
Yeah,
Karen Russell, Community Liaison for Mountain Valley Regional Rehabilitation Hospital. Thank you.
Thank you. Thank
and
you again for having
have
me.
a great time, National Rehab Week.
Yeah, it's fun. It's a lot of fun.
Thank